Welcome to NAHUC's virtual library. NAHUC is a professional association for health unit coordinators and other frontline healthcare professionals performing similar tasks. NAHUC is the provider of professional development for healthcare support team members. NAHUC is pleased to offer this webinar, Patient and Family-Centered Care, as presented by Alyssa Jones, the Director of Patient and Family-Centered Care at Joe DiMaggio Children's Hospital, a division of the Memorial Healthcare System in Florida. We are grateful to Alyssa and her team for providing this content. This presentation first debuted at NAHUC's Education Conference in June of 2021. Information about earning NAHUC contact hours through the virtual library can be found at the end of this presentation and on the NAHUC website, www.nahuc.org. Please enjoy this presentation.
Hi everyone, my name is Alyssa Jones. I'm the Director of Patient and Family Centered Care and Community Engagement here at Joe DiMaggio Children's Hospital. I just wanted to talk to you a little bit about patient and family centered care and our culture here at Joe DiMaggio Children's Hospital. We have 5 key concepts here at Memorial Healthcare System. 4 of them are through the Institute of Patient and Family Centered Care: dignity and respect, collaboration, partnering, and information sharing. But we here at Memorial added the need to be near because we know how important it is for our families to be present at the bedside with their loved ones. Who better to truly understand what's going on than that family member who can help partner with us to take care of their child or take care of their loved one while they're here in the hospital. We all have the same goal. We want to get them home safely. We want them to have health literacy so they understand what's going on with their care and so that they can best take care of themselves while they're home. At Joe DiMaggio, we have 2 advisory councils. We have a parent advisory council and we have a youth advisory council. And we meet every month, now virtually, hopefully back in person soon, to discuss various things that are going on in the hospital. We have our administration that reports out to our council members so that our members know what's going on here in the hospital and can participate in all the different initiatives, programs, meetings that are going on here in the hospital. To keep that parent voice is so important. Our youth advisory council meets to discuss various different projects that they want to do with the patients and families when they're back here in the hospital, and they talk about all the different initiatives that are going on. They help with construction conversations to make sure that that youth voice is heard as well, because who better than the actual patient who's been here in the hospital. We are growing another 4 floors, and part of that growth requires conversations, requires partnerships with our advisors, and so we're very much in line with our advisory council to make sure that those conversations are happening. Our administration is very supportive of our advisory council and of patient family centered care culture. They just know it's the best way to take care of our patients and families. It's the safest way to take care of them, and it's just the best quality. So we as a healthcare system strive to be the best here, and I think that we do a really great job of that, and it just shows. You talk to staff, and they're so passionate about being here, and they're so driven to involve our families, to make sure our families are at bedside shift report, that they're a part of that communication, and it's just so crucial. You talk to other families and they'll share with you how they feel like home. They feel like that the hospital here is another part of their family. They feel safe, and they trust the care that they're receiving, and that's super important. So patient and family centered care started way back in about 2001, started by Dr. Nick Macy and his family. He had a daughter who was diagnosed with a childhood cancer, and was treated here as well as other facilities throughout the country. And he always shared that he was always labeled a difficult parent or a challenged parent because he didn't want to leave. He didn't think there should be visiting hours. He wanted to be at his child's bedside. He wanted to hear shift report. And after doing some research, he heard about patient and family centered care and heard that this was a slow moving progression that hospitals were going towards and how important it was. And he did more research, and he brought this research and his experiences and his feedback to our administration here at Memorial. And in 2001, patient and family centered care was introduced to our healthcare workers. A lot of education, a lot of conversations took place because there was definitely some, questions. What if the parent hears too much? What if the child goes into a code and we have to do life-saving treatments? How's the parent going to handle that? And all of that was addressed through Dr. Macy and his team to help alleviate state any of those concerns. And after so much time, the staff saw that there weren't any of those concerns or fears that were coming forward. It was actually helping them. They actually saw that there was less questions from the parents and the families because they were at that shift report. They heard the report. They knew what was going on. And the parents who were able to be in the room during specific treatments or procedures weren't in the way. They were there safely in an area so they can stay close to their loved one and see all the efforts that the staff were doing. So it became known that this was such a powerful way to have care for your child because of involving the parent, because who better knows their child than the parent does. And it just obviously became very clear that we needed to partner more with those parents. So this just grew into a huge way of life for the hospital. And so advisory councils were born through here at Joe DiMaggio and through the entire Memorial Healthcare system. And with that grew the parents' voice and the parents' perspective and the parents' involvement in their child's care. And they felt more heard, they felt listened, and they felt like they were a part of the child's care. They felt that they were partnering with the staff, that it was the nurses and the doctors not taking care of the child for them, but taking care of the child with them, that they felt a part of that medical team. So from when Dr. Macy started back in 2001 to now, we've had so many recognitions, so many awards because of our patient-family center care philosophy, because of our patient-family center care mission. We were the first children's hospital back in 2017 to be Plaintree certified, and that's amazing. That's incredible. Plaintree is a nonprofit organization that designates or certifies hospitals, facilities to be person-centered care. We were the first children's hospital in the world to have that, so we were very, very proud of that. We did just finally complete our recertification process, and we cannot wait to hear back in July about that recertification, but we know and we're so confident that we will maintain our Plaintree certification. Along with that, patient-family center care is just such embedded in everything that we do. We're literally the foundation of all of our pillars here at Memorial Healthcare System. So everything from U.S. News and World Report to Leapfrog, all of that, it has patient and family center care. We're striving for Magnet now here at the Children's Hospital, and patient family center care is, a priority in that as well. So that just goes to show just our passion, our culture, our continuous strive to be the best that we can possibly be to help take care of our community, help take care of our patients and our families. So I mentioned the 5 key concepts here that through patient family center care. You're about to see a couple of the videos that represent dignity and respect, information sharing, and partnership.
The experience of being with my husband who was dying on a ventilator, and he had established that he was to be a no code and not be kept alive if he should have a cardiac arrest with defibrillating. And he went into a cardiac arrest, and the staff come running and were ready to do code on him, and I said no. They asked me to leave the room, and I said I want to hold his hand while he dies, and I did. And I'm so grateful that I had the opportunity to be with him in those last hours.
Dr. Adler comes in and says, guys, here's the deal. Nick's got pancreatitis, and we're both sitting there thinking, oh great, we're going to have to stay overnight. All right, fine, we'll stay overnight. And he said, you guys are going to be here 4 to 5 weeks. And we're like, well, wait a minute. 4 to 5 weeks.
We only packed for 1 day.
Yeah. We're like, okay, well, how about we just stay tonight and you let us go home in the morning? And he's like, no, it's going to be 4 to 5 weeks. I think that right there might have been the probably critical event in that first day, was that he, on that first day, said to us, he didn't say, you know what, you're going to be in here a little while, or you're going to be in here a week, and then a week later tell us another week. He said, here's the deal. You're going to be here 45 weeks, and that allowed us to make a plan.
One example which comes to mind of our whole family-centered care concept and what we are trying to promote in the unit is a situation that occurred with me about 2 weeks ago when I was on call at night in the NICU at Joe DiMaggio Hospital. I was doing my night rounds like I normally do, and I came to the bedside of an incubator which housed a premature baby who was about 1.5 to 2 weeks of age. Both parents were at the bedside, and I introduced myself. I am Dr. McIntyre, just doing my night rounds to make sure everything is going okay. And I asked them where their nurse was, and they said, well, she's busy on the other side of the room. So I said, well, I was just trying to get night report. So the dad looked at me at that point and said, I can give you the report. So I said, really? He says, yeah, I'll start with the report. So he told me, my little one has been on CPAP for the day, has had a couple of apnea and bradycardic episodes, but nothing very significant, nothing needing stimulation or any sort of aggressive intervention. So we've had a fairly comfortable day on the respirator. So I kind of smiled and I looked at him and I said, really? He says, yeah, what anything else you need to know? So I said, well, keep going. You're doing a pretty good job at this point. So he says, well, let's talk a little bit about the feed-ins. We've been gavage feed-in for the day. There have been just a couple of residuals, nothing too concerning. All of them look just milk colored, nothing green, nothing brown, nothing that looks concerning in any way. So the feeds are going pretty well. So I looked at the wife at that point and I said, I like this guy. I really like this guy. I think we may keep him. And that's just sort of an example of the involvement that some of the parents really get into in the unit, and frankly that's what we like to see. The more involved the parents are, we think the better the whole hospitalization is going to be.
Hi everyone, welcome back. Right now I have Italia Faleco, our chair of our Patient Family Advisory Council here at Joe DiMaggio Children's Hospital, and I have Lisa Nadeau, our secretary of our Patient Family Advisory Council here at Joe DiMaggio. And we just wanted to talk a little bit more with them about their roles here, how they support our families, and what brought them here to the Advisory Council. So my first question for you both is, why is patient and family center care so important in the Children's Hospital?
I think that it is a perfect or fabulous opportunity for all of us to work together on setting goals for the benefit of patients and families as they address their healthcare needs.
Mm-hmm. Yes, awesome.
I think it's a great opportunity for parents to give feedback and, as a way to improve the hospital and the environment and relations with the patients.
So, and Italia, I'll start with you. What brought you to the advisory council? What made you join our advisory council?
Wow, mine is a little bit of a long journey and a little different than a lot of our advisors, many of our advisors. My daughter did not survive her cancer and the cancer treatment. So it took about 7 years for me to come back and work with the hospital staff and administration and in the council on being the voice of the families and children. My daughter was diagnosed in 2004 with osteosarcoma, rare childhood cancer. She went through treatment and did very well. However, one of the chemotherapy agents that killed the cancer ended up killing her heart cells. So in 2007, a little over 3 years, she went into heart failure, which could not be reversed unless she had a heart transplant, and she was not eligible for that due to the short period of time between treatment and an open wound that she had from the multiple surgeries on her leg. She considered the hospital her second home. She was a spokesperson for the hospital from the age of 9 to 12 years. She was a fundraiser for the hospital. She made bracelets and donated money to the Love Children's Cancer Fund, to the Breast Cancer Center in order of the hospital, in honor of one of her nurses. So her dream was to be able to continue to do that when she was done with her treatment, when she was able to go back to her everyday life. But unfortunately, we lost her in August of 2007. Like I said, it took a little bit for me to come back and to the place where I lost her, but I knew that we needed to continue her legacy of giving. My younger daughter, as she got to middle school years, began to come with her school, their school, to do some arts and crafts with the children under a club called Daniela's Journey at the school that they were attending. And once she became of high school age, she became a volunteer for the hospital. She was also a member of this Daniela's Journey club from her school, and it was participated in all kinds of activities. So that was my way of coming back into the hospital to work with the parents. Since she was beginning to continue and carry Daniela's legacy, I decided to see what I can do to work with the amazing group of parents that had the council together since 2004, I believe, right? Or 2003. One of Daniela's dreams, and that's from the old Patient, Family, and Center Care Director, Dr. Nick Macy, was to be part of that Youth Advisory Council. So that's how we returned to the hospital, by trying to continue her legacy and trying to be the voice and give back in any way we can. And for the support and love that we received. We lost our daughter, but I know that everybody was part of our journey. Everyone was. When we lost her, everybody felt the loss because we were like a family for everyone in the hospital. Yeah, that's how I came back.
Oh, that's beautiful. Thank you for sharing. Lisa, how did you join the Family Advisory Council?
Well, I have two children. My first one was born at 30 weeks, so he spent 6 weeks in the NICU, and he was born with a cleft lip and palate. So he's had many surgeries here over the years. 2 years after him, I had a daughter, and she was born at 27 weeks, and she spent 3 months in the NICU. And they actually really saved her life because she got a staph infection, and had the nurse not found it so quickly, she probably would have passed. So, we owe a lot to the hospital for both my kids. And my daughter's had numerous procedures here herself. So many years later, when I had the opportunity to come and give back, I thought it was great, for everything that the hospital has done for us. And especially in trying to support the NICU parents. My journey was very lonely, a first-time mom especially, and not wanting to open up to anybody at the time, not knowing anybody who'd spent time in the NICU. So I like to come back and try to help those parents through with their journey. And my son, when he was 14, actually came back and participated in the Youth Advisory Council as well. So just trying to give back and make things better for other parents as well.
Awesome. Thank you for sharing. What are some things that you guys do as advisors here at Joe DiMaggio? What are some projects or some initiatives that you have been a part of?
Well, as a council, we work in all kinds of initiatives. Whatever initiative is presented to us by administration or by staff or by, from you, being the director of Patient Family Center Care, we take on and we work on it. I remember a couple of years ago, we worked on a big initiative of the notebook that we created based on conversations among us, the council members. And we developed this notebook to distribute to parents so that they can make notes, so that they can have questions ready for the healthcare professionals that were taking care of their child. So that was a big initiative, I think. I think it was sponsored by the Florida Healthcare Association, but it was an effort that was positive, and we were able to touch a lot of families by creating this notebook with the type of questions that they should ask, based on our own experiences. That's one thing that I can think of. I don't know, what do you think,
Right.
Lisa?
One of the things I think that's important is our mentoring program. So, some of our advisors will go around and speak to the parents in the hospital from a parent perspective. It's often a lot more comforting to talk to another parent than it is maybe to staff. So I think that's one of the big things that we do. But we also do things to support staff. Help the nurses or celebrate the nurses on Nurses Day. Try to make their lives a little bit easier.
Yeah. So
One
go
of the
ahead.
things that I really enjoy, and it has been very different and very positive since COVID, is the opportunity to attend a lot of meetings in which our feedback is considered, greatly, and then they use that feedback to make decisions. So I think because most of us, if not all of us in the council, work full time, before we didn't have the opportunity to be as visual and as verbal, because it was hard to just leave your office and come to a meeting in the middle of the day. But because it's virtual, now we really, really have a strong presence in every meeting when making decisions for, visitations. As the numbers in COVID change, they have to make decisions, and they we are the voice. We give the feedback, and then they take that to a higher level, and then of course they make the final decision. So that's one thing that I think is very strong on our side, being able to be present in all the departmental meetings. I mean, we attend clinical leadership meetings. What else? I mean, there's
So many,
so
yeah.
many.
Department leaders, safety and quality meetings. I know you guys are a part of those, and I know it's so wonderful because you report out at our monthly meetings, so the advisors know what's going on in the hospital. They know the pulse of the hospital and what new topics are being discussed. So I think that's really, really important.
One of the things that I didn't participate in, but I'm very grateful that the Patient and Family Center Council participated in, was given input into what went into the new hospital. So as a mom who spent time with a child in the old hospital, those chair beds were not very comfortable. So I was very grateful to the parents who gave input into the new beds in the patient room. So us parents who spend the nights with our children in it, much more comfortable.
Yes,
Yeah,
I agree.
That's one thing that we do a lot. Yes.
Yeah, a lot of those construction meetings lately, especially helping to manage a lot of the noise that's going on in the hospital because of our construction. So, so I'm glad you brought up the COVID and the pandemic, because that's definitely has affected so many different levels of the hospital in so many different ways. And there's been a lot of positive, I think, things that have happened with our council. I mean, we definitely have seen some changes, but all the virtual support, I think, has been great. And we've seen that it's so important to keep that going, not just to keep in touch with everybody, which is so important, but to make sure that our hospital keeps our culture, because it's very easy to say, to not think of the families, and because they're not at the bedside because of the pandemic and such. So it's super important now more than anything to have our advisors involved in everything that we talk about and keep that culture.
And I think the beauty of the culture of patient-family-centered care is that staff and us, families, advisors, share the same values of taking care of families, not only medically, but their souls and their needs. So sharing the same values and being supported by the leadership or administration, I think, makes a world of a difference.
I agree. Yes, I agree. So that's super important to have. It really trickles down from above to make sure that that we're involved in things that are discussed here in the hospital, and invited to all these different wonderful committees, whether it's COVID operational management advisory council committee, or it's a hospital committee, to have that parent perspective. It's so important.
And to have the administration come to our meetings and give us an update every month, I think is also
Right.
extremely
agree.
helpful. The CNO and the CEO
Mm-hmm.
come in and, give us an update on what's happening. So that's also
I agree.
very nice.
Yeah. And I hear all the time from families just how they feel that the staff truly care about them, that they're being listened to and heard. And that's really, a testament of us supporting the staff and saying, how can we help you and, partner with you so that you can take care of your patient and your family the best way possible. And so that I know that that's really, really important. So Lisa, you mentioned the mentoring program. So tell us a little bit about what you do with that, and when you're in a family's room and you see potential opportunities for us to address some concerns.
So with the mentoring, what I'll do is I'll go around to patient rooms and, especially in the NICU is where I round, and talk to parents and moms and see how they're doing, if they have any concerns that they have, if they're feeling okay, if they're getting the support they need, and if there are issues that they bring up or concerns they bring up, I always bring everything back to you so you can handle it from a higher level, or right away we'll talk to the charge nurse and see if there's anything we can do right away.
Yeah, because I know, there's nobody best than another parent who's been in their shoes, really to kind of talk with them and to truly understand what they're going through. So I know that's so helpful for that staff to have you there to round. And I know so many opportunities have come forward where we can have family care conferences that include all their doctors and their medical team providers to address any of those parents' questions and concerns and to make sure that they feel listened and heard. So I know that mentoring is just so important to our families.
Right.
So thank you for sharing. So along with mentoring, we do a lot of education with staff, which is so important and just really helps to cultivate our culture here at Joe DiMaggio. So Atalia, can you tell us a little bit about some of the educational opportunities we've had?
Yeah, that is one of the big initiatives that we started a few years ago, and we've worked very hard on it, and it is to try to educate or re-educate or refresh staff's memories about the whole concept, culture of patient family centered care. So we do twice a year. We do have a nursing residency education module that we come in and basically do a little theoretical session on what a patient-family-centered care is, and then we share our stories and we ask the nurses who have been already in the hospital under the residency program for a few months to share whether they have experienced that patient-family-centered culture or not. So we do a lot of that. We also did a lot of work with medical residents, and that's a program that we did before COVID, right? And hopefully we'll pick it up again after. And we also did was it a 2 or 3 session, three-part session, educational session in which we talked about the theory of patient-family-centered care, but then we also took it a little step further and we did case studies and went through a problem-solving method of how they would have identified whether somebody was actually being patient-family-centric or violating that.
Right.
And it was a fabulous opportunity. And you also do the medical.
We do, yes. Elise, one of our other advisors, and I do the medical students, third-year medical students with NOVA and FIU, yes.
So that is a very strong part of our council to educate and re-educate and refresh people's memories on what patient-family-centered care is, because people can forget sometimes. They're new employees and they haven't been here long enough to drink the Kool-Aid.
Right, yes, for sure. So how do we recruit our advisors? What do you think is the best way that we recruit? I know staff is a huge component of that. It's our staff reaching out to us saying, hey, Alyssa or Atalia, Lisa, I think I have a really great family. What are your thoughts on recruitment and what we can continue to do? Because I know even during COVID, you know, we recruited some advisors, and they've been fantastic, and it's been wonderful. So, and I know I've talked to other advisory councils throughout the country through, WebExes and such, and some of them haven't been able to do that. So I feel that that's been so great that we've been able to do that. So, what are your thoughts on recruitment and how we do that?
I think mentoring helps a lot with recruitment, just going around and getting to know the families and speaking to them. And oftentimes it's the families who feel really supported, and they tend to want to give back, you know, and they're so grateful for what we do that they like, you know, once their needs are settled and stable, they'd like to come back and join and give back as well.
That's true.
One thing that I find is word of mouth. You know, that's what's happening. You know, one family speaking to another and just letting them know about the work that we do and how we can be the voice for change and the voice for new initiatives. And that's how we've recruited a couple of people through COVID, is word of mouth. Yeah, so
I agree.
it is doing that. And that is one of our goals for the future, to increase membership.
Yes.
You know, we do have some subcommittees that we had some subcommittees before COVID that we were actively trying to recruit members, but of course, you know, not being in the hospital makes it very hard. But that is one of our goals for the council, to increase membership. Although we have a very solid group of advisors, but the more, the merrier, the more input, the more feedback, the different points of views that allows us to, you know, work with it.
Yeah, absolutely. Absolutely. I think that is one of our main goals is growth of our advisory council, you know, to have more families involved and have more of that parent perspective. And same thing with our youth advisory council, get more of our youth involved so that they can be a part of conversations. So,
and mentorship is another
yes, absolutely.
big goal that we have.
Yeah. Well, thank you so much for talking with me. I appreciate it. It's good to see you in person.
Thank you.
Thank you so much for giving us the opportunity to talk more with you about Patient and Family Center Care and our Patient and Family Advisory Council here at Joe DiMaggio Children's Hospital. We are so honored to be a part of this journey, and if you ever have any questions or want to reach out and get more information, talk directly with me or some of my advisors, please don't hesitate to reach out. Thank you all.
Thank you for watching this webinar. Please follow the instructions on the screen to earn NAHUC contact hours. You may visit our website, look for education, click on virtual library to access the post-test and instructions. Please call or text or email with any questions that you may have. Our contact information is listed on this slide.